Sharon and Pate, and I want to show you how to do passive range of motion on your dog. Passive range of motion is something that we do to increase movement in a joint, to maintain normal range of motion, to increase flexibility, but also in certain cases to decrease pain and swelling and stiffness. So we're going to demonstrate on this beautiful dog here, and when we start we want the patient to be relaxed, completely relaxed, so all the muscles are relaxed, because part of passive range of motion is doing this without any without muscle tension. So right now she's laying down. You want your dog to lay on their side for this, and you can start either in the front or the back. You can be on either side, but I tend to feel like I have a little more control when I'm behind them. So we're going to start with her front leg here, and for a dog, this is her carpus or her wrist, this is her elbow, and this is her shoulder. And when we do passive range of motion, what we're doing is trying to isolate each joint, and we're going to flex and extend each joint individually. Lay down, sweetie. So we'll start with her shoulder. So her shoulder's up here. To extend her shoulder, I'm going to gently push on her leg so that this joint becomes extended. I'm going to stop when it naturally stops or when she shows me any kind of discomfort, and I'm never going to push past the point that's comfortable for her. To flex the shoulder, here's the joint right here, I'm going to come back like this and then hold it for a few seconds. And usually we'll try to hold it for about 3 seconds, and I'll try to repeat it about 5 times for each joint. Now moving on to the elbow. For the elbow, flexion is achieved in this manner, and then extension like this. So I'm extending this joint until it naturally stops. I'm not pushing past what's comfortable for Leia. And then for flexion, same thing. It naturally stops, and then I'm just holding it. And then this is her carpus or her wrist. So flexion. Now a lot of dogs actually flexion, their paw pad can almost reach their forearm. So she has a little bit of decrease in flexion there. And this is extension. And most of the time extension looks just like a straight leg for the carpus. Extension, flexion. Okay? And then moving on to the hind limb. So for the hind limb, we have hip, knee, and tarsus or ankle. I didn't show in the forelimbs, but we can also do passive range of motion of the digits or the toes. And that actually is really important, because a lot of times the toes don't ever go through any range of motion. But we'll start with the hip. So her hip, you can find the hip joint by following the femur bone until you feel a little bump, and that's where her hip is. So hip extension is oftentimes something that's really hard for most animals. She naturally just did it. I just gave her a little scratch. She's in full hip extension right now, and she's holding it herself. And then we're going to move up to flexion. Now she's not totally relaxed, so when a dog starts to use their muscles, you kind of can massage and let them relax. I'm trying to get her to relax. Okay, now we're going to flexion. And then let's go back out to extension. If I do a little tickle, she'll extend. If a dog ever doesn't want you to do this, is pushing against you so you can't do this, you just stop. You never want to push past the point that's comfortable when you're doing passive range of motion. Flexion and extension. So that's the hip. The hip is oftentimes one of the most difficult joints to get extension on. So just, be careful when you're extending the hip. This is the knee or the stifle. So it's in a flex position right now. To extend the stifle, so she's resisting that a little bit. I'm going to try to massage her legs so she relaxes. Yeah, just relax, baby girl. Okay, there you go. All right, now here we go. So extension of her knee. So most dogs will have kind of a straight leg when you extend the knee, and then flexion. Okay, so I just want to show a good way to hold your dog if you're having a hard time getting them to stay laying down when you're trying to do passive range of motion. So I do like them to be on a soft surface like a dog bed. And then if you can get them to lay down, sometimes what I'll do is actually take my one leg, and it's not on their neck, but it's kind of just blocking their head from popping up. So I'll take my leg, here we go, like this, and kind of bend my knee, and then I can have this kind of telling them, okay, lay down, you're gonna stay laying here while I do the passive range of motion. So that's one way to help. You do have to have a little flexibility to get in this position, but it is really helpful, because then I can work back here without worrying about her popping up. Okay, so now we're flexing her stifle or her knee, and then she's resisting a little bit for extension, but here we go. A lot of times if they resist for motion, you just gently keep going until they relax. So there's extension, flexion, and extension. And then here is her tarsus or her ankle. So flexion, you can hold it for a few seconds, and then extension. She's pretty comfortable with that. She didn't love her knee extended, but she's very comfortable with her tarsus. And then the last are her digits. So you can either go digit by digit and flex and extend the individual digits, or what I normally do is I'll flex and extend all the digits together. So flexion, and then extension. And always a gentle movement. If it ever seems to cause pain or discomfort, you always want to stop and reevaluate what you're doing. Okay, so that's a quick tutorial on passive range of motion.